Good afternoon, my name is Emma. Today I will be presenting on health promotion that targets diabetes mellitus in Aboriginal and Torres Strait Islander people. I will be the only one presenting. During this presentation, I will discuss the links between culture and Aboriginal and Torres Strait Islander people, health promotion targeting diabetes mellitus in Aboriginal and Torres Strait Islander people, and as well as considerations for culturally competent and safe nursing practice. The aim of this presentation is to understand how culture can influence health in Aboriginal and Torres Strait Islander people, the social determinants that can lead to the development of diabetes mellitus, in particular type 2 diabetes, and the need for cultural safety in nursing practice. Aboriginal and Torres Strait Islander people's beliefs on healthcare systems is greatly influenced by their spiritual connection to the land. However, their connection to the land, as well as their physical activity and nutrition, has changed over time with the arrival of the Europeans in 1788. Although the shift in lifestyle for many Aboriginal and Torres Strait Islander people, their cultural beliefs are still very strong, which can lead them to not seek healthcare when needed. Not all Aboriginal and Torres Strait Islander communities share the same belief systems when it comes to their health and spiritual connections to the land. Therefore, it is important to understand that all communities do things differently. Aboriginal and Torres Strait Islander people still value their traditional medicines. They see hospitals as a place of dying. This means that in order to close the gap, it is vital to take into consideration the cultural, environmental and social determinants of Aboriginal and Torres Strait Islander people within healthcare services. Urban communities are communities that live within the metropolitan area. According to the Australian Bureau of Statistics, New South Wales has one of the highest numbers of Aboriginal and Torres Strait Islander people residing, with the majority living in Western Sydney. Even though the majority of Aboriginal and Torres Strait Islander people live in urban areas, there is still a gap in their access to health services due to transport issues, financial circumstances, fear of discrimination, or a previous bad experience, and a lack of culturally appropriate services. This is where the Closing the Gap campaign can be beneficial by introducing Aboriginal community-controlled health services that aim at prevention and early intervention, therefore allowing Aboriginal and Torres Strait Islander people to achieve better health and well-being outcomes. The World Health Organization states that the health promotion is the act of allowing an individual to have control over their health needs. Closing the Gap campaign is a health promotion framework aimed at helping Aboriginal and Torres Strait Islander people achieve greater health and well-being outcomes by making access to health services easier. For example, introducing Aboriginal controlled health services that are easily accessible, affordable and safe. Diabetes mellitus is a chronic disease where the body cannot maintain a healthy level of glucose in the blood. There are different types of diabetes, however, our focus is on type 2, which is generally developed by poor nutrition. It is one of the fastest growing diseases in the world with no cure. Aboriginal and Torres Strait Islander people experience high levels of diabetes compared to non-Indigenous people. The factors leading to diabetes in Aboriginal and Torres Strait Islander people are usually a combination of cultural history, socio-economic status, and education. There are a number of health issues associated with diabetes, such as renal complications and cardiovascular disease.